Excited.
There. Thank you so much for attending. Today we are going to have a meeting about don't expect immediate results, celebrating the milestones. We have Dr. Neil for presenting, and after the presentation, we're going to have a question session, so you can have the chance to ask all of your questions, Dr. Neil.
Perfect. Thank you so much, Ava and Ahelia, and everyone else on the team that's helped to facilitate this meeting and make this happen. I'm Dr. Neil Naik. I'm a family doctor in Waterloo. I'm also the regional primary care lead for cancer screening for the Waterloo-Wellington region. Um, my expertise is in family medicine and cancer screening. I'm not an expert in oncology, so I do apologize if I can't answer your questions, but by all means, please do ask them. And just another caveat here as well is that I cannot provide you with specific medical advice towards your particular condition or a family member's condition, just because I'm probably not their primary care provider. And if I am, they should be talking to me directly or privately. So I do ask that, hey, questions are great, but try and keep them general. I will refrain from answering questions that are not, that are super specific towards a particular condition or your condition, I should say. I don't mind answering questions in general about conditions. The other thing you're going to notice on the slide deck is that all the images here have been generated by AI. I'm a big fan of AI. I use it almost daily in my practice as well as in my life. I'm always a big fan of celebrating the new technologies that we have. And so I just want to give a heads up that that's why the numbers are wrong on the posts on this image. But that just shows how much further we have to go with technology, science, and everything else. But it's always a great learning curve. And so today's presentation, as Ava had mentioned, is don't expect immediate results, and it's all about the small milestones and celebrate them as we go along. We have this tendency, especially in this consumerism post-pandemic world of needing something now, or I call it the Amazon yesterday moment, where we expected the information yesterday, we expect the goods and services to be delivered yesterday. Why can't you anticipate my needs? And there's a couple things that happen during the cancer journey that doesn't facilitate that, whether that's a delay in diagnosis, whether that is challenges in regards to technologies, challenges in regards to access, but also we don't take the time to celebrate those small wins as well in terms of when we do get that information, when we do hear about the small wins that actually show that improvement over time. And so I want to go over a couple of key points here and discuss what immediate results look like. And so that's exactly what this slide is going to show, is discussing small victories rather than immediate outcomes. It takes years for things to develop. It takes time for things to get resolved as well. And small victories are those small steps towards that end goal. And that mindset can help to support that motivation and mental well-being. And that's what actually helps to build up on long-term success. And we'll talk about the science behind that as well. And so when we think about healing, it's both the physical and the emotional, and the two are interrelated. This concept of the brain body relationship is very much true. And we do know that how we think can affect actually how our health is, whether that's your blood pressure. For those who joined a little bit earlier, you may have heard me talking about blood sugar levels and the amount of stress that we take on, how well we heal, how much time we spend going out into the community, spending time spreading information, participating in volunteering, or even just going on a hike through the forest. And all these things have reparative, restorative aspects towards our health. And that leads back from both the emotional to the physical and vice versa. As we can think about it, if you were to exercise, if you were to participate in outdoor activities, that actually improves blood flow, makes your heart better, counteracts a lot of the side effects that radiation therapy, chemotherapy, medications can do, and the two of them work synergistically together. We cannot expect just one thing to do all the work for us. And that's what leads to that unrealistic expectation. That's what leads to a lot of that frustration, discouragement. And that has a recursive aspect back into our bodies in terms of saying, hey, you know what, I'm not doing so well. I am frustrated. Why can't I have that? Why did somebody else get access to something that I didn't get? When in fact, it's most likely somebody's in a different situation, different medications, different life situations. And shifting that focus from towards that gradual progress can help to reduce that anxiety, can lower that blood pressure, as I mentioned before, increase perseverance, and actually can improve outcomes in the long run. And so when we think about milestones, no matter how small, can mark progress and reinforce positivity. And we want to celebrate each one of those through challenging times as well as good times at the same time. Um, and we want to recognize that progress, even if it is just meaning, hey, you know what, the symptoms got better. And that's why every single time somebody goes into the cancer center, we do those symptom management pieces. It's not just for the collection of data. Part of that research was also on the self-reflection that patients had when they were doing those questionnaires of saying, hey, what is my pain level like? What is my appetite like? What am I doing that makes me happy, sad? Why am I sad? How can I advocate for myself when I go see my clinician or my nurse to say, hey, this isn't going so well. Can you help me with this so that we can plant that next flag on our journey and make strides through small steps and recognizing that progress along the way of the work that we've done. And some practical ways that we can do that, like I said, is self-advocacy, but part of that is also knowing when you should be self-advocating for yourself. And so I actually tell a lot of my patients to journal. Now, a lot of people remember, and I'm one of the folks that still remembered grade school being handwritten. And then also in my grade school, we transitioned over to computers as well. So I get to live in the dual world there. And so my handwriting skills are really bad. They're probably worse than what the AI wrote here. And so a lot of patients do have a hard time saying, well, you know what? I can't see as well as I used to. My hands are shaking from the medications. I don't, I keep losing the papers because I can't remember with this brain fog. And what I usually recommend is what's the one device that you hold on to all the time? And usually it's a phone. And what I'd recommend doing is actually getting a simple app on your phone, and all phones have a note-keeping app. And journaling through that is still journaling. And things there would be talking about daily improvements. My notepad, actually, for my own just daily note keeping is mood 1 to 10. What am I at today? And then why? I might throw in why I'm upset today. Or why am I good today? Trying to highlight, hey, what did I do today that made things better? Just a heads up, the latest thing I did was introduce a new AI scribe into my office, made my life a lot better. The second thing I did with that extra time is I started going for walks. And part of that is having that reinforcement cycle of saying, cool, I introduced this new thing that helped my life out, whether that's socializing with friends, whether that is going out and going for a walk, whether it's actually having time alone to think about my future and what that looks like, and saying, hey, you know what? This makes me feel better. I do have that mental clarity. I have decreased that pressure and that burden on my shoulders. And I mean, I'm getting stronger to more of the waves that keep crashing on my desk or in my home or in my life. And it actually makes it easier for me to tackle some of those larger goals I had by saying, you know what, I just need to do that one step first. That's what's stopping me from going into the basement and putting away my stuff to, hey, going outside to the backyard and just sitting there and gardening. It makes it into much more achievable steps, and that overall helps you with your outcomes. The other important part that journaling has brought out is my ability to communicate. I mentioned earlier about advocacy and advocating for oneself towards one's healthcare professionals. And a lot of times as a physician, the biggest challenge I find that some of my patients who don't journal have is they don't know how to verbalize the challenges that they're having, especially there on the spot in the office. And those who spend maybe even 10 minutes, even right before the appointment, but ideally about a day or two before the appointment, to say, why am I going to go see Dr. Naik? Why did I book this in the first place? And they write it down. And those conversations have one more impact on my patients in terms of saying, that is, it's not anger, it's frustration. It's not that I'm angry at the medical system, I'm angry at so and so for, being disheartening. It's a whole bunch of different smaller things that they can tackle that breaks it down. And so that communication improves. But also, I find that a lot of my patients and a lot of people that I know from my personal life get frustrated at their loved ones and those that are closest to them, not on purpose, but more so because there's an expectation of why don't you understand how I feel and what I feel? You live with me on a daily basis. How come you don't get this? Without understanding that, hey, that person's also suffering as well as much as you are. There is caregiver distress, and that this is a two-way street amongst all of us. And so by being able to share with one another, that journaling aspect actually helps to formulate how we feel and communicate more effectively with them so that our frustrations aren't projected onto somebody else. And so when we talk about celebrating those small wins, that reflection piece becomes a big part of that. Whether that's reflecting with our partners, with our family members, with our healthcare professionals, whether that's a big thing or a small thing, whether that means, hey, my appetite increased, or hey, I was able to walk to your office without getting short of breath. It could be about rewarding yourself in terms of a meaningful way, in terms of, hey, I feel good about myself. And that small moment of gratitude means that you're not kicking yourself. And that's probably the biggest thing I see a lot of my patients do is kicking themselves because, hey, you had a bad day, and that's okay. The more common one is, I can't believe I got sick during flu season. And my usual response back to them is, it's flu season. Almost everyone's going to get sick. It's not your fault. And sharing those victories and building that connection, engagement, encouragement, but also everyone here is also a community member and helping to spread that to one another in our communities so that others also have that sense of hope and can also celebrate their wins. And so when we look at that long-term success, we're looking at reducing those pressures. We're looking on building that trust as well in that process of maintaining a healthier, a sustainable mindset and making sure that we don't ignore the small wins and seeing that as a step in the right direction. My apologies, not the wrong direction, the right direction. And so when we look at supporting self-compassion, it's that acknowledgement, the lack of self-criticism, reinforcement, and building on that self-image that grows with you. And as I mentioned, it's that community that it starts to build as you share that with your loved ones, as you share that with your friends and families, as you help those who need help, who may not have friends and families to share with. And so attending those group communities, attending the meetings, being able to share one story when one is ready, right? Not forcing anyone to do something that they're not comfortable doing, but when you feel ready to share that journey, it actually allows for you to feel not alone because you've experienced something that many others may have experienced as well, but maybe too shy to mention. Or you might be helping somebody with a win that you've discovered that somebody else just might need that little nudge to say, maybe that walk, maybe that tea, maybe that conversation is the right way to go for me to just self-reflect, journal, and think about something in a different way. One of the most recent ones that I saw, and I won't release any information because it is a growing trend in healthcare, is the lack of access to primary care. And hey, I can't get access to that primary care provider. And sometimes people don't mention that to other people. In our community, we have about 20 to 25%. So 1 in 4 to 1 in 5 individuals don't have a primary care provider. These networks and these communities that we build can actually help to facilitate and say, hey, by the way, did you know that nurse practitioner-led clinic in Breslau is accepting patients? And by even giving that small bit of hope and that encouragement and that information, you're building, again, another small win in terms of saying, hey, we can help to build our community and help to facilitate people to get the care that they need. We could say, hey, that psychotherapist down the road really helped me, and they really helped me with this particular type of cancer. Fantastic. That's another step towards that emotional wellness that we're looking for. Or, hey, there's that physiotherapist or exercise activity program at the local YMCA that really helped me on my journey when I was in this phase of my cancer journey. And that can really help somebody get out of the house and be in a more healthier environment where they can go out and exercise. And so it provides validation, gives encouragement towards that journey, and it'd be things that other people would otherwise overlook and not mention of, yeah, of course I go to the gym, don't you? Without understanding that, no, there's a lot more towards just saying, hey, go to the gym. There's the challenges around that, and how can we help support each other? Whether that's, hey, I'm going to pick you up tomorrow morning and take you to the gym because I know you're interested, but you don't have the means to do so. Let me help you out there. And so when we celebrate each step of that journey, we're actually building upon our health. We're helping our community along the way. and we're actually increasing actually our odds of being successful in our journey on our cancer journeys. So I know this slide says conclusion, but I'm probably going to say we're not done yet because I want to go through the science. Um, why does this matter? Because our brain is wired for a reward system. I put sugar in my tea today. I did that because I'm presenting today and I want to give myself a reward for putting myself in front of all of you and putting myself in a position that I feel uncomfortable sometimes in. But by giving myself that dopamine release, eventually I'm hoping that I don't need to do that over and over again. It's that biochemical response that reinforces that positive behavior and makes us more likely to look at future goals and maintain a positive feedback loop. It's one of those reasons, and I never understood this for a long time as to why people get runner's highs. So people go running and then they feel good about themselves, whereas whenever I go running, I feel horrible afterwards and can't go to work. And there's that moment where it flips and you're like, I actually do get that runner's high and I can't go to sleep anymore. I used to run in the evenings because it would knock me out and I'd go to sleep. And then I switched over to the mornings. And it's that same aspect of you do it over and over again, you try and spin up that flywheel, and all of a sudden your brain takes over. And it's that positive feedback loop that actually makes that happen, and it is a real thing. And by doing that, it enhances our self-worth, our long-term satisfaction. We start noticing more positive things around us rather than just the negative things. And we start to build our self-esteem and confidence. And there have been studies that have actually shown that we have better coping mechanisms, but we actually have better physical health. And we saw that regardless of somebody's demographics, their socioeconomic factors, their education, their age, their gender, their ethnicity. We know that positive reinforcement and breaking down small wins makes a difference. And we actually also see that in a lot of medical studies that are not cancer related as well, in regards to people with different mindsets actually do better regardless of the drugs that they're on. There is we call that the placebo effect. I'm actually going to argue it's not necessarily a placebo. It is actually our brain's positive reinforcement cycles that does this. It's one of the reasons why placebo works sometimes. So, there are things that we can do that can foster a healthy community and make us an inclusive community that helps to support one another. And we really need to celebrate those milestones, no matter how small. I was speaking to a survivor recently. Their name is Scylla, and I got permission to one, say their name, but two, to quote them here. And it's every day I try and find some moment of pleasure, even if it's sitting in the sun for 5 minutes. I heard that quote about 2 weeks ago, and I immediately moved my desk over to the window, hence why half my face is in the sun, the other half is not. And it's primarily because of that quote of this actually makes me feel good. And in that moment of, hey, I'm going to spend 5 minutes of my day just sitting there and reflecting on my day. I might write something right after in my journal, but it gives you that moment to just self-reflect of what was your day like? How can I be, have I made a difference in my own life? It's great if I make a difference in somebody else's life afterwards. And how can I do that again? Because that's what allows me to personally grow, but also help my community grow as an overall healthier community and more fulfilling life. So that's the end of my presentation. I'm more than happy to take questions though. And I'll see if I can get my automatic light to turn back on so half my face is not dark.
Thank you so much, Dr. Naik. It was a great presentation and like covered many aspects. Now we open the floor for questions. Like, feel free to unmute yourself and ask questions, or you can type it on the chat and I will read it.
See, I do have some questions if no one else does at the moment. Can you give us some examples on how to break down larger goals into smaller, more attainable ones so that it's easier to celebrate those littler milestones?
For sure, yeah. Now, bear in mind, for me, I'm a very analytical individual, but I'll give a couple of different examples here, right? Um, so for me, let's say, I'll take a real example. So my father went through the cancer process and journey and was not successful. I was one of his many caregivers for him. And when we broke down what a win was for him, it did change over time, but What it also meant was that when he was able to go up to his bedroom, that was a win. When that meant that he could go through his garden, that was a win. When his cancer journey was actually improving, what we did in order to make sure that we had that positive reinforcement was we said, okay, cool. We as a family got together and we said, um, and we did this both with him and without him, just to make sure that he didn't feel overwhelmed, and we want to make sure that we could level set as well. Uh, Back in India, he was a farmer. Here in Canada, he was an accountant. And so we know his love for gardening. We knew his love for walking through the orchard. So we said, okay, how do we get him to an orchard? How do we get him apple picking? We knew apple picking was going to be 6 months away. And so we said, all right, well, why don't we start getting him to walk? Why don't we start rehabbing him? But he was not a big fan of physiotherapy. He was not a big fan of a traditional exercise program. And so we would, my mom was phenomenal at this in terms of making sure he got out of bed, he felt refreshed, he got a shower, he got fresh clothes on, he didn't lie in bed every day. And each one of those, each single day, was a win until it just became the expectation because he was like, I like the way I feel when I take a shower. I like the way I feel when I get shaved. I like the way I feel when I can come downstairs and have my tea. And then it was, all right, let's have that tea outside. Okay, when the weather is good. Let's find out, hey, how much can we, does he want to walk? Does he want to go anywhere? As kids, um, I'm going to stop for a second. But yeah, I do recommend breaking it down that way.
Thank you so much for the answer.
Sorry about that. But breaking it down makes it easier on the caregivers, but it also makes it easier on the patient so that every day is a win. And even if things go downhill, that's okay. They had that experience.
Thank you
Since,
so much.
yeah.
Sorry,
Oh, go
sorry.
ahead. Yeah.
I just wanted to say that thank you. I know how hard it is to share it, but I'm sure like we all appreciate it so much. Yeah.
Thank you. I'm good for the next question. Don't
You're
worry.
okay.
Yeah.
Yeah, thank you for sharing that. It's having that connection, that real life experience is really powerful for all of us as well who have had those experiences too. So thank you for being vulnerable and sharing that with us. Um, have you seen this kind of goes back to one of your last slides of have you seen the differences in outcomes in patients who celebrate the milestones versus those who do not celebrate milestones and like what those differences may be?
Without releasing patient information, I'm a little bit more reluctant in terms of answering that question in specific terms of which patients and stuff like that. I'd say in general, people who tend to have more of a positive outlook from studies, have actually been shown to actually have a longer lifespan
Mm.
and also have a higher survival rate. And we see that over and over again when we do placebo-controlled trials, but also whenever we do observational studies that look into the future. So we do know that positive outcome has a positive impact on our long-term health. Now, of course, there is a there's an element here of what your body does and how a cancer will react and stuff like that. But for the most part, we know a positive outcome does have a positive impact on our lives.
Mhm. Thank you.
Yes.
Um, is can you talk about how to combat the feelings that kind of come along with feeling like the process is going too slowly or taking a couple steps forward and then taking one step back and
Yeah.
what that process is like as well?
Yeah, it's hard actually. A lot of times it could be as simple as, hey, why didn't I get my pathology results when I expected them to? why is it harder for me to go for a walk today than it was yesterday?
Mhm.
Um, that one's a lot harder, and sometimes you also need that third person who can look at you and say, "Look, overall, you're better than last week." When we're looking at the step backwards, and so it's always about, hey, what's the overall image rather than the day-to-day experience. I actually associate it also towards, um, it doesn't have anything to do with cancer therapy or the journey itself, but more in terms of people who are trying to lose weight for health reasons.
Mhm.
People saying, well, I was up 3 pounds today and yesterday I was down 3 pounds. It's like, that actually doesn't matter. That's just water weight. It's the
Mhm.
overall trend from a week to week, month to month basis. So, um, small wins for sure, but you can actually become hyper focused, and that's not a good thing either. The other part here, when we talk about the medical results and how long it takes sometimes to get treatments and diagnoses and test results, that challenge with treatment results is not because we're trying to harm patients, but also because we want to make sure that when we're going to give a diagnosis, we know absolutely sure that that's the right diagnosis. The worst thing that could possibly happen is if we say somebody didn't have cancer, they did have cancer, or somebody did have cancer, we say they didn't. Uh, right? And so we want to make sure that when we say, hey, it's spreading versus not spreading, we are absolutely sure because that is somebody's life that's on our
Mhm.
hands. And we want to, and that's why sometimes it takes a while. The other part there is science has progressed to a point now where we're actually looking at the genomics, the genetics behind it. We're looking at the staining. We're looking at which drugs. We're no longer just giving the same chemotherapy for all cancers. It's very specific for a lot of specific types of cancers. And so when we're looking for those results, it could take maybe an extra test that might take an extra little bit of time, but it also means that you might get a drug that works better than just the generic drug. Now, this all depends on the type of cancer you do have, and we don't have the solution for every cancer, as many of us know.
Right. Okay. Thank you. And just my last question is when someone is trying really hard to maintain that positive outlook and celebrate those small milestones, what is your suggestion? Excuse me, if your loved ones don't share that same outlook in that same positive headspace?
And when you say loved ones, do you mean the person who is suffering or the caregivers around them?
The caregivers.
Yeah.
Yeah.
That happened actually. I can actually speak towards that from both a personal experience, but also as a professional in that
Mhm.
space. Sometimes some of my patients will actually come to me, or their caregivers will come to me and say, "Can you just speak to my sister, brother, mother, father, friend who's here as well? They don't understand what's happening, or they're telling me the wrong things that I need them to stop." The other part could also be, again, from a personal experience here, sometimes that caregiver or that patient themselves needs to talk to that person and say, what you're doing is harmful. I need you to stop.
Mm.
And I think setting those boundaries is really important because it puts not just the patient, but the people who are trying to be supportive of that individual into the wrong headspace, and that makes a bad impact. And it might sound selfish, but you know what? I think we have this really bad connotation that selfishness is bad. I think in this case, it's a good thing to speak up for yourself and say, I don't like this negative connotation. I need you to stop. And that really makes an impact. And I have done it both in a personal and professional point of view of asking somebody to be like, what your actions are doing are having a negative impact on the patient. I recommend that you actually start just rephrasing it a different way. I understand where you're coming from in terms of, hey, yes, you are a little bit weaker. Yes, you are eating a little bit less today. But imagine what that feels like for the other person. Instead, let's switch that around and say, hey, are you feeling hungry? Yeah, no worries. Let me help you out with that. Or if you're having a challenge swallowing it, hey, maybe that's where we actually start introducing, a speech and language pathologist to help you with swallowing. Or go talk to your primary care provider to see what referrals or recommendations or medications we could provide to increase your appetite. And so it's about changing I call it a diamond. There's multiple facets to the same thing. It's about switching the diamond on its own 90 degrees and looking at it from a different angle and saying, okay, you're not eating. Let's stop with the negative terminologies. Let's switch over to the positive terminologies. And it doesn't have to be a solution-based one. I tend to work on a solution-based mind, but it doesn't have to be solution-based. It could just be like, hey, no problem, you didn't finish your boost. We'll save that for next time when you feel better. And we can put that in the fridge rather than pressuring the individual to eat more, drink more than they actually should.
Right. Thank you, Dr. Naik.
Bro.
Thank you, Sarah, for the questions, and thank you, Dr. Naik, for the answers. To like build on that conversation, so what are some of the examples that can friends and family kind of support this milestone celebrations if they want to contribute?
Yeah, absolutely. I think identifying what the patient loves is probably the first step, and seeing whether or not they're able to do it. And if they're not, can you find a substitute for that experience? Whether that's bringing the garden inside, whether that's breaking down the process, whether that's going for a ride. And trying to figure out, hey, what supports can we do to help break down those milestones, mimic them, make a different experience, or even find a new hobby, whether that's painting or something like that, but not trying to force somebody to do something they absolutely don't like to do. Right. So those would be the different ways a caregiver can be involved. I think loneliness is probably the biggest challenge in our community. We see that in Japan. We see that here in Canada. People don't know who their neighbors are. I think that community building, having that family, making sure somebody's present all the time is such a huge part. And making sure that you're available for that friend and family member. Because if you feel lonely, imagine what they're feeling. And especially, and then if they don't have those beings, making sure that you can, on their behalf, with their permission, connect to services that can help them. There are volunteers that do go out and they do spend time with patients to make sure that they are not alone. There's also a safety component to that as well. Should somebody ever be choking or fall or it needs to go to the bathroom and physically can't, or you call 911 in some cases, not all cases.
True. Thank you so much. Does anyone else have any questions?
Yeah, just one question for me. Again, thank you, Dr. Naik, for that great presentation. So just for patients who are, let's say, who have a terminal illness and they're not able to leave the house, do you have any resources that they can use to kind of connect to the social community, maybe to have a better social, support system?
Absolutely, yeah. So there's a few different groups. The first one off the top of my head is HopeSpring. The entire organization has great connections as a community and can find resources that somebody may need in order to get the services they need or to make themselves feel better. The second part there is also, I had a patient recently that went to the YMCA, and the YMCA actually had a couple of volunteer programs, and so chatting with them is a great win. The third part there, in terms of resources in the community, sorry, I went blank. Give me 1 second. If somebody does have a terminal illness, they've been referred to the palliative care program. Hospice Waterloo has a lot of resources in the community and programs for both caregivers as well as the patients themselves. Whether that's getting a haircut, whether that's attending group sessions, whether that's massage therapy, to help connect them to the community, make themselves feel good. But if any of you guys have any comments or thoughts on that, you guys know way more than I do. That's why I refer my patients over to you guys.
Great, thank you for that.
Thank you so much. I'm not sure if anyone else has any questions. If there is no more questions, I guess we can thank Dr. Neil for your time. We really appreciate it. I learned a lot. I'm sure it's very helpful for the patients and all the caregivers as well. Thank you.
My pleasure. Thanks so much for having me, and feel free to reach out, ask questions. The HopeSpring folks all know how to get a hold of me, so if you do think of anything afterwards, feel free to reach out.
I just
Thanks,
want
sounds
to
good.
remind everyone that this is going to be recorded and is going to be shared in our newsletter. So if you didn't get chance to review the whole part or technical part, you can always go back to it as well. And thank you so much for being here.
Perfect. Have a great day, guys.
Thank you. Have a good one.
Yeah.
Have a good